Good morning, everybody. Today we're here with one of our B2 students giving a wonderful presentation with a very interesting topic. So, without any further ado, here she is.
Good morning, my name is Erika Ortiz. I'm going to talk about tooth caries and sensitivity. Before about this topic, we must know as dental anatomy, which in charge of studying the dental structure, the types of the teeth, part of the tooth, function and movement in an individual way and related to other teeth. Part of the tooth. The third part is enamel, is the hardest and the most resistant tissue in the body and the more external part of the teeth. It doesn't regenerate in case of breakage, and in addition, the enamel doesn't have nerve ending, so it doesn't cause pain. The second part is the dentine. It's found below the enamel and gives the white color to the tooth. It is very sensitive to temperature change and its main functions, its main property are hardness and permeability. In addition, it is elastic and translucent. The next part is the pulp. It's a soft tissue and that located under the dentine and is its response stimulus such as pressure and extreme temperatures. The next is the cementum. It's the more external layer of the tooth root that firmly attaches um, the roots of the teeth to the bone through periodontal ligament. The periodontal ligament is the set of collagen fibers that help keep the teeth to the bone. Mm, Function of the teeth depending on the morphology of each tooth. The more important function are chewing food by molar teeth and pronouncing words and study by incisors and canine teeth. Mm, Types of the teeth. Incisive teeth, the superior incisors are the ones we show when we smile. Um, there are 8 teeth, 4 frontal and 4 lateral. They have only one root, and their mention apart from aesthetic is good food and facilitate its crushing by the molars. And the next is canine teeth, and also known as fangs. And they are used to help the incisors when cutting and tearing food. There are two on the top and two on the bottom. The next are the premolar teeth. And there are 8 premolar teeth, four on the bottom and 4 on the top. The locator behind the canines and before the molars. The next, the molar teeth, they are the largest pieces um, and are known as grinding wheels. The located are at the back of the cage with 6 pieces on the top and 6 pieces at the bottom. Dental caries. The dental caries is a chronic dynamic process or disease that occur in the dental structure in contact with microbial deposits and due to imbalance between dental substance and the soldering plaque fluid. The result is a lot of mineral of the dental surface. It's classified as disease transmissible and irreversible. Disease transmissible and reversible. Mhm. How can prevent dental cavities? Sorry. Brush your teeth brush your teeth 3 times of the day, especially at night, to remove plaque will build up on the tooth surface and between teeth and gums. Also, toothpaste better with fluoride. Um, Go to the dentist regularly because early diagnosis will help us prevent major problems. Change your brush teeth every 3 months. This will prevent that bacteria will prevent the bacteria of in the filaments of the brush. The next, be careful sugar foods and drinks. If we take them in between the meals, if we must brush our teeth as soon as possible to prevent sugar from staying in our mouth for a long time. Treatment for cavities. In an initial cavity, the dentist will make the filling, first removing the affected tissue and then placing the filling in that space. The next, if the caries has reached the dental pulp, the dentist have to perform a root canal, removing the nerve. In advanced cases, the tooth can be completely destroyed. In these cases, it's necessary to extract and replace the lost tooth. Tooth sensitivity is defined as acute dental pain caused by dentin exposure that appears after contact with such as hot or cold, sweet or acid or right touch. Um, Causes of tooth sensitivity: poor oral hygiene allows the accumulation of oral biofilm, um, in special in cervical level, which can be destroyed the enamel and cement. Nice. Acid diets and drinks. Certain foods have low pH that contribute to dental erosion of enamel and cement, such as citrus fruits, jams, wine, tea, or soft drinks. Dental treatments. Periodontal surgery can cause slight removal cementum and apical displacement of the gingival margin, which can result in gingivalization. Whitening treatment in the clinical uses in the treatment use different procedures and substance that can cause temporary dental sensitivity. Mm, General diseases, pathologies that occurs with acid in our mouth, the therefore produce dental erosion, for example gastric ulcer, anorexia and bulimia, and can also cause dental sensitivity. Treatment of dental sensitivity: correct oral hygiene with different products sensitive is essential. Sensitive toothbrush for sensitive teeth with bristle extra some results for sensitive brushing or cleaning, and apply appropriate brushing technique. And non-abrasive toothpaste or gels and mouthwash with active ingredients for dental sensitivity. When these outpatient measures fail to reduce or eliminate sensitive, the clinical treatments will be performed are applied desensitizing gels or applied resin adhesive to seal the tubules and gums wrap to cover sessions. In very extreme case, is necessary a root canal. My recommendation is go to the dentist every 6 months to avoid prevent several problems in your mouth. Thank you for the attention.
Thank you very much, Erika, for your wonderful presentation. It was great and it's a very interesting topic.